Hello everyone, today we will look para-amino phenol derivatives. And in the para-amino phenol derivatives that come in the group of analgesic, antipyretic, with poor anti-inflammatory actions, and in this the example is paracetamol, that is also called as acetaminophen, and it is also known as Calpol. And the main function of paracetamol, which we should remember, हमें याद होना ही चाहिए, that is the used as antipyretic, anti-inflammatory, antipyretic, analgesic, and it has minimal anti-inflammatory effect. Now we will look the action of paracetamol, that is acetaminophen. It is action. Its action is same as the aspirin, means central analgesic action, centrally जैसे analgesic action of paracetamol is same like aspirin. क्या करता है ये? It raise कर देता है, raises the pain threshold. बट अगर हम लोग पेरिफेरल की बात करें कि पेरिफेरी में कैसे करता है, वीक पेरिफेरल और एंटी इन्फ्लामेटरी कंपोनेंट. Because here I written also कि paracetamol is used as antipyretic, anti-analgesic, and it has minimal anti-inflammatory, मतलब बहुत कम anti-inflammatory effect होता है किसका? paracetamol का. जो paracetamol है उसको हम लोग mostly antipyretic की तरह यूज़ करते हैं. So here we will write this was the analgesic action, okay, and that was big peripheral anti-inflammatory. For the antipyretic we will write that paracetamol is good and promptly acting antipyretics. After that, the paracetamol has the ability to inhibit COX-3, that is an isoenzyme of COX-1, means, or you can say the splice variant of COX-1, okay, and this is the ability to inhibit the COX-3, okay. This account for the analgesic and antipyretic action. Aspirin has many side effects which paracetamol does not have, so we will write here that in contrast to aspirin, paracetamol do not stimulate the, I will write in the point wise, that is the respiration, which was stimulated by aspirin, does not affect the acid base balance, and do not increase the does not increase the cellular metabolism, and also it has no effect on CVS and gastric irritation is insignificant. That is the but like mucosal erosion, bleeding can occur when we take the paracetamol in overdose. So you can write also here that gastric irritation is insufficient, but mucosal erosion and bleeding occur rarely if there is overdose. Does not affect the platelet function or clotting factor. Does not affect platelet function or clotting factor. Now we will look the pharmacokinetics of the paracetamol. So pharmacokinetics, and we will look that paracetamol is also well absorbed. Paracetamol well absorbed orally, and 1/4, only 1/4 bound to plasma protein, bound protein, 1/4 protein bound protein to plasma, and it is uniformly distributed in the body. Then how is the metabolism occur of paracetamol? So metabolism, it occur mainly by conjugation with glucuronic acid and sulfate, and when that is conjugated with the glucuronic acid and sulfate, conjugates are excreted rapidly in the urine. And this conjugation with glucuronic acid and sulfate, this is occurring in liver, and you can means तुम्हें आप समझने के लिए कह सकते हो कि एक सल्फेट ग्रुप होता है, वन सेल्फ हाइड्रिल ग्रुप होता है, वन सेल्फ हाइड्रिल group is there, okay, and that is called as glutathione, and paracetamol से ये अटैच होता है, paracetamol अटैच है and उससे फिर inactive हो जाता है, and then it rapidly liberated in the urine. नीचे भी थोड़ा और बताऊंगी उसके बारे में, बट अभी इतना ही. Then because I will tell about a particular NABQI की टॉक्सिसिटी ये सब कैसे हो जाता है हमारे बॉडी में. देन आई विल एक्सप्लेन कि एक्सक्रीटेड इन यूरिन, देन हाउ थोड़ा सा और आफ्टर दैट. नाउ वी विल लुक व्हाट आर द एडवर्स इफेक्ट of using the paracetamol. That is the first, when it is given in the antipyretic dose is given, then paracetamol is safe, and that is well tolerated, and sometimes occasionally nausea, races that occur, but it is rare. Okay, after that, what are the acute paracetamol poisoning? Here we will write acute paracetamol poisoning. The acute paracetamol poisoning that occur mostly in the children who has very low glucuronide conjugating ability. जिस लीवर के पास बहुत कम होता है ग्लूकोराइड की कॉन्जुगेट करने की एबिलिटी, अगर बहुत ज़्यादा डोज बड़े में भी ले लिया then serious toxicity can occur. So we will write that it occurs especially in the small children who has low hepatic glucuronide conjugating ability. And it is in the small children, and if a large dose, how much large dose? That is greater than 10 gram in adult taken, then serious toxicity can occur. When the toxicity occurs, the manifestation the early after 12 to 18 hours, after 2 days, we will write those timing and the what it lead to be. First, the early manifestation that is the nausea, vomiting, abdominal pain, liver tenderness, and here no impairment of consciousness. Okay, this was the earliest manifestation. After 12 to 18 hours, what occurred? That is the centrolobular hepatic necrosis occur, and which may be accompanied by renal tubular necrosis and hypoglycemia. And this all three conditions can lead to the patient to coma condition, lead to coma of patient. Okay, then after 2 days, jaundice can occur. And the toxicity depend on the dose taken. Okay, if the plasma level is very high, like if plasma level very high, then the patient may die. Just fulminating hepatic failure and death can occur. Fulminating hepatic failure plus death are likely to occur. And if the levels are low, then recovery with supporting treatment is the rule. So if the level lower, then recovery with supportive treatment is the rule. Now, what are those supportive treatment? That first is the give attention to ABC. What does ABC means? Airway, breathing, and circulation. They are the initial measures. Okay, if there is any poisoning, in the management of poisoning, The first we do is give the attention to ABC, airway, breathing and circulation. It means that ensure that the patient airway, patient airway, give them acute ventilation, give artificial respiration, oxygen inhalation if needed. Okay, because when the patient is suffered from a severe poisoning, the respiratory drive, these are airway reflex, they are lost. So first give attention to airway, breathing and circulation. On the second thing, for the paracetamol poisoning, we do the gastric lavage. Gastric lavage is done by activated charcoal, so that if there is some drugs are available in the stomach, then it could absorb those chemicals. Okay, and gastric lavage should be done if there is a report coming that he has taken within the 2 hours. Okay, if the patient is came to you within 2 hours with injection of poison, then you can give the activated charcoal and you can absorb those chemicals. Okay, but this I am telling about the paracetamol poisoning. Gastric lavage is not means activated charcoal does not absorb the strong acid, alkali, iodine, cyanide, alcohol, hydrocarbon. Okay, they are not absorbed by the charcoal. So this is for paracetamol. Then we give the antidote. Third, antidote is given. Specific antidote is given. Example, for the paracetamol we give in acetylcysteine. This was how you can manage the patient who has came with paracetamol poisoning. This is the first supportive treatment that you have to give. Now, what are the mechanism of the toxicity? Mechanism of toxicity. So this paracetamol, this is converted to NABQI, that is the N-acetyl P-benzoquinoamine. So here you write N-acetyl P-benzoquinoamine. Okay, and this is done in the liver, converted in the liver, and this is the harmful product. Okay, and this is detoxified by the conjugation with glutathione. So this N-acetyl P-benzoquinoamine, that is detoxified by conjugation with glutathione. Okay, so what is it is done there is the here it also I have written one sulfhydryl group is added. Okay, and that make the NABQI non-toxic, and that led it to be excreted in the urine. So addition of sulfhydryl group, and that lead to it become non-toxic and excreted in the urine. But this but the liver has a minimum capacity to detoxify this NABQI. But when a very large dose of paracetamol is taken, when a large dose of paracetamol is taken, then what happens? The glucuronidation capacity gets saturated and more of minor metabolites are formed. And hepatic glutathione is depleted and द मेटाबोलाइट जो कि माइनर मेटाबोलाइट बना दैट बाइंड कोवैलेंटली, सो इट इज़ इम्पॉर्टेंट दैट इट बाइंड कोवैलेंटली टू प्रोटीन इन द लीवर सेल एंड ऑल्सो इन द रीनल ट्यूब्यूल्स। जो हमने बोला था कि 12 घंटा के बाद हिपैटिक नेक्रोसिस हो जाएगा, उसके साथ रीनल ट्यूबुलर नेक्रोसिस भी हो जाएगा और हाइपोग्लाइसीमिया भी हो जाएगा। तो दिस इज रीज़न कि बहुत ज़्यादा हमने लंबा डोज ऑफ पैरासीटामोल ले लिया, जिससे क्या हुआ, ग्लूकोराइजेशन कैपेसिटी जो हो गया सैचुरेट हो गया। तो जो बहुत सारे अन्य मेटाबोलाइट्स बने, जिससे क्या हो गया कि और हिपैटिक ग्लूकोथायोन डिप्लीट हो गया, जिससे क्या हुआ कि मेटाबोलाइट बाइंड कर गया कोवैलेंटली टू प्रोटीन इन द लीवर सेल एंड रीनल ट्यूब्यूल्स and this caused necrosis. A question it is asked various times that why paracetamol is not taken, not used or not given in the alcoholic patient. Because what happened, the alcoholic patient, okay, even if they take 5 gram one day, that can result into the hepatotoxicity. Why there is hepatotoxicity? Because the the person who is a chronic alcoholic, that is alcoholic person, they have less glutathione, so they cannot change the the NABQI into the detoxification cannot occur very easily because they do not have glutathione, so they will lead to the toxic condition and there will be stimulate hepatic glutathione deplete हो जाएगा, तो मेटाबोलाइट बाइंडली कोवैलेंटली प्रोटीन से बाइंड हो जाएगा लीवर सेल में और रीनल ट्यूब्यूल में and that will cause necrosis. So here we will write that the liver cell of the alcoholic person, they produce less glutathione, okay. So liver toxicity जो होगा ज़्यादा हो जाएगा, liver toxicity will be more even those person with chronic alcoholic, so even if they take 5 gram one day, they can result in hepatotoxicity. And this was the one thing कि less produce करता है. One thing और भी था कि जो alcoholism होता है, alcoholism, it induces the C/P231, okay, जो कि क्या करता है, बहुत ज़्यादा जितने पैरासीटामोल है, पैरासीटामोल को NABQI में मेटाबोलाइज कर देता है. तो एक NABQI में मेटाबोलाइज भी हो रहा है एंड द लीवर हैज़ लेस ग्लूटाथायोन ऑल्सो, सो दोनों तरफ से डेंजरस है. सो इट कैन कॉज द लीवर टॉक्सिसिटी एंड could cause the renal necrosis also. This was the reason. Now the treatment, if the person has gone with the paracetamol poisoning, then what will be the treatment that I have written already in this, that should be given supportive treatment is the rule, okay. Like what I will write some point here also कि treatment में क्या करेंगे. अगर पेशेंट बहुत जल्दी आ गया within 2 hours that brought earlier, तो हम लोग उसको वोमिटिंग करवाएंगे, वोमिटिंग इंड्यूस करवाना है, ओके, या तो फिर गैस्ट्रिक लेवास एंड एक्टिवेटेड चारकोल हम लोग उसको देंगे, ठीक है ना. फिर एक ये हो गया. सेकंड में कि हम लोग उसको स्पेसिफिक एंटीडोट देंगे, that was which was the specific antidote, N-acetyl cysteine, okay. Because what N-acetyl cysteine does, it basically replenish the glutathione store. जो भी glutathione store लीवर में था उसको फिर से दोबारा रिप्लेनिश करता है एंड तो फिर से हमारे पास ग्लूटाथायोन होगा, तो और किसी भी प्रोटीन और भी लीवर प्रोटीन सेल में और रीनल सेल्स में बाइंड नहीं होगा, तो फिर नेक्रोसिस नहीं होगा. दे आर बेसिक राइट की N-acetyl cysteine एंड दैट replenishes the glutathione store of liver, and it prevent binding of toxic metabolites to other cellular constituent. Okay, after that, now we will look the uses of paracetamol. So we cover the paracetamol under different headings. This is the uses. So paracetamol, we all from the very childhood, every child know the name of the paracetamol, because the paracetamol is the most commonest drug. Okay, so this is also named as the over-the-counter drug. Okay, for any analgesic, for the analgesia, like for headache, mild migraine, if there is any musculoskeletal pain, okay, if there is dysmenorrhea, then people uses paracetamol, but it is relatively ineffective in the inflammation. Okay, and so here we will write that paracetamol, it is most commonly used over-the-counter drug this for as analgesic, that is for headache, mild migraine, musculoskeletal pain, dysmenorrhea, etc. Okay, and we all know that it is relatively ineffective when inflammation is prominent. Okay, and in which the inflammation is prominent, like rheumatoid arthritis. Okay, after that, but the osteoarthritis, the doctor of osteoarthritis, they recommend paracetamol as the first choice of drug as analgesia, and it is one of the best. This was about the over-the-counter drug for the analgesic. Now we will look for it is the best drug to be used as antipyretic for fever due to any cause. Like we have seen, when we give aspirin, then there is correlation between the aspirin or salicylate therapy and Ray's syndrome. But when we give the paracetamol, there is no risk of Ray's syndrome. So best drug to be used as antipyretic for fever, due to any cause. Fever किसी भी रीजन से हुआ है, and especially in children, there is no risk of Ray's syndrome. But antipyretics, one exception is there, that antipyretic not useful in fever due to heat stroke, because here what happened, only external cooling lower the body temperature, and the where it is used means कि जहाँ पे aspirin नहीं use कर सकते, like in the patient with the gastric irritation, ulceration and bleeding, we will not give aspirin, but we can give the paracetamol. So we will write in gastric irritation patient, okay, and ulceration, bleeding, the aspirin is not, because aspirin has side effect on all that, aspirin is not safe, but paracetamol safe है. Okay, hypersensitivity reaction also do not occur as a side effect. Okay, no any I've written already कि कोई भी metabolic effect, कोई भी acid base disturbance नहीं होता है. And the paracetamol can be given to all the age group person, and also to the pregnant and lactating women. So it is very important. You can write that paracetamol can also be given to pregnant and lactating mother, women. And we have seen that aspirin के बहुत सारे ड्रग्स के साथ इंटरेक्शन होता था, but it does not have significant drug interaction. Okay, so it is preferred over the aspirin for most of the conditions. Thank you. That's all about the aspirin. Please like and share this video, and please do subscribe my channel. Thank you.